Welcome to a new episode of Your Friendly Physicist and Other Nerds. I'm Lucas, the host of this podcast, and I talk to scientists, founders, and other nerds all around the world. And together we take a close look at trends in cutting-edge technology, how researchers can bring their ideas from the lab to a commercial scale, and generally we talk nerdy stuff. Today we will talk about the story of Aakash Shah and his company Wyndly. Aakash is a founder and currently located in the New York area. And he has a mission, and the mission is to cure allergies forever. And for this cause, he founded the startup Wyndly. And today we will discuss how the science behind Wyndly works, how founding a company in the US generally works, and what differences we see in the US and European startup scene. So welcome to today's guest, Aakash Shah, founder and CEO of Wyndly. I think we still can call it startup, right?
It's still a startup. We're still growing fast.
And Wyndly focuses on the treatment of allergies by providing a personalized immunotherapy treatments for its clients. Do we say clients?
Clients, patients, whatever you want to say. Yeah, we used to call them patients because I think it's important that we have a medical context within the company. And yeah, what we do is we fix allergies forever. That's the goal here. If you can't breathe, if you're afraid of peanuts, you can come to us and we will make it so that you don't have to live like that anymore. You can have your pet cat or your pet dog, or you can go outside in the spring, or you can have a peanut butter jelly sandwich. That's the goal here, right?
That sounds great. And this will be our topic today. So what's the science behind Wyndly? How does it work? But also, how does the startup culture look like in the US? Really looking forward to this aspect of the episode, especially because we recently had a few guests from the startup scene in Germany and the UK. So I'm going to provide a bit of context there, and you're going to explain how it's looking like in the US. Maybe a few words to you. Please correct me if I'm wrong, or jump in if I'm missing out on something. Because before founding Wyndly, you've been around for quite some time. I think mainly on the one hand as a full stack engineer, but also as a founder of other companies. Quite impressive. You've also been a guest lecturer at the University of Virginia. So it's a quite impressive CV. I'm very happy to welcome you to the show. And if you want to add anything to your introduction, feel free.
Thanks so much for having me on. That was an excellent introduction, Lucas. Yeah, no, I mean, it's interesting to hear you talk about where I've come from. You know, I think of myself as someone who's always wanted to build a company. I've always wanted to put something out into the world. And when I kind of looked at my skill set, it ended up being, well, it's going to be something with software. And when you're building software, if you want something that has your name on it and people know it has your name on it, you end up having to basically build your own company or build your own product. It doesn't have to be a company. I think those are my skills and my ambitions pushed me kind of to having to eventually just keep starting companies, keep trying, and do it often enough until you kind of hit one that starts succeeding. And that's what we did here at Wyndly. So with Wyndly specifically, you know, I personally had this problem. I was a horrible allergy sufferer. I couldn't breathe, basically. And I needed to fix this because breathing is good for you. Breathing keeps you alive. I know it seems obvious, but it's good to it's good to set the ground stakes here. So, you know, I'm feeling very bad. I go to the doctor. The doctor says, you have bad allergies. Go see an allergist. And it takes me months to see an allergist. It's impossible to get the care I need. And then when I'm actually there, they say, yeah, I'm going to put you on a 5-year treatment plan, and you have to come in every week for 5 years, and it's going to be an hour-long visit. And that's just not something that fits my lifestyle. I don't know whose lifestyle that fits, Lucas. An hour commitment every week for 5 years, no vacations. Like if you're late, you're in trouble. Like it just doesn't work. So I gave up for approximately 2 weeks. And then I was complaining to my family about it. And my cousin said, actually, no, there's a treatment that I did when I was in my medical training. I think I can get you on it. He got me onto what's known as sublingual immunotherapy. That actually took care of my allergies after I saw the initial results in a few weeks. And then after a few years, it was gone for good, it feels like. And once it helped me, I was like, I got to get my wife on this. And then once it helped my wife, I was like, I have to get my sister-in-law on this. Once I helped my sister-in-law, I was like, this is too good. I have to tell the world about this. So once I told the world about it, we were able to apply to Y Combinator, and Y Combinator kind of took us off the ground. So that's kind of been our journey from what was I like when I was younger to how did I actually get to sitting in front of you today talking about what I do.
Well, it's an amazing story, especially how you combine your skill set. You said it, yeah. The idea to put something out in the world that helps people was always there, and then out of a personal story and your connection to your cousin and this success story of fixing your allergy, making this company, it's great. Can you briefly explain concept of fixing your allergy?
Yeah. So an allergy is when your body is exposed to something, and even though most people's bodies would say, oh, this is not harmful, your body believes it is harmful and it starts having an immune response. So most commonly you see this when people are allergic to dogs and cats. When
Mm.
exposed to a dog or a cat, they start sneezing, they start coughing, they get a runny nose, they get itchy eyes, they might break out in hives. That is what an allergy is, right? And in the world today, you are told by advertising and by pharmaceutical companies that the only treatment is an antihistamine. Now, what an antihistamine does is it's like a band aid, it covers up the symptoms, but it does not fix them at the root cause. So, this is like saying, oh, I broke my arm. I'm going to take a Tylenol instead of, getting your arm actually fixed. That's what an antihistamine is. And so, if you only have allergies 1 or 2 weeks, or only when you see a cat or a dog, you might say, fine, I'll take an antihistamine for that 1 or 2 weeks. But if you're someone like me who had horrible allergies for the whole year, who couldn't breathe every single day, who just felt like they were dying at all moments, then you actually need something that works. And an antihistamine, I didn't want to take a drug every day for the rest of my life. Mm-hmm. Well, there's side effects. It makes you drowsy. It gives you grogginess. This is like, I didn't want to do that for myself. What immunotherapy does, and this is a treatment we do at Wyndly, is it actually changes your immune system. It changes the immune response from from causing all those allergy symptoms to having it not cause those allergy symptoms. And the way it does that is it desensitizes your immune system, right? And you do that by giving the patient small doses that are gradually increasing over time, and this builds this tolerance. So this is how we fix allergies forever, is we build a tolerance within people's bodies so that they just don't get their allergy symptoms anymore.
When you said change the immune system, build up tolerances, etc., it's something like a training for your immune system, basically, right? But do you have any side effects there as well?
Yeah, it is training for the immune system. Yeah, for what we do, the dosages we give you start out so low that it's incredibly, incredibly low risk. If you go into a doctor's office here in the US, so the way we provide it is we provide it through an oral tablet or an oral drop. So you take it every day through your mouth. In the US, when you go into a doctor's office, they give you an injection, and the injections actually have a high risk of anaphylaxis. Anaphylaxis is a severe allergy response, which causes constriction in your throat, which can lead to suffocation. So the treatment itself, this immunotherapy as a concept, can be risky when it's delivered through a shot or an injection. That's actually why, if you're taking injections, you should be under observation at all times, which is why you do it in a doctor's office. Whereas for us, because we let you do it at home, because we make it super available, we have to use a modality of the treatment, which has a much safer risk profile.
And the safe risk profile is because the concentration is simply lower than with the oral injection compared to a stab or something like this.
The biggest one is the way your body reacts to being stabbed is different when you put something in your mouth because, we're putting something into our mouth all the time when we eat. So it's just your body just is able to understand what's happening, and it's much less invasive and much less aggressive. But clinically, I mean, this is clinically proven. This is something that the World Health Organization says you should use. It's used in Europe. It's not very popular here in the United States. And so our goal was, this is a better way of doing the treatment. Let's make it more popular here in the United States.
Is there any reason why it's not that popular in the US?
The way to understand the United States healthcare system is it is all dependent on the incentives. So how do people get paid? And everything in the US healthcare system is biased around what's known as health insurance. In the US, everyone pays into a giant pot of money, and the people that control that pot of money decide if you get your healthcare or not. And so they also decide, well, we're going to do allergy shots for a variety of reasons, but we're not interested in doing allergy drops. So if you're a doctor, you're going to prescribe the thing that lets you get paid. You're not going to prescribe the thing that lets you not get paid. And that's because doctors have their costs also, right? There's no greed involved. It's just how the system is set up. And it's the core conceit of a startup is that you can change the system and beat the system.
Yeah, I mean, you did in kind of a way. I mean, maybe it's a drawback that doctors are not able to prescribe other things that would make more sense. But on the other side, it gives you, as a founder of a startup, the possibility to fill up this gap or this niche.
That's exactly it, right? The incentives are incorrectly shaped. So there's an opportunity there. And I just have to find a business model which will fill that opportunity.
So when you have your patients, how long does it take?
So what the patients actually experience is, we realized that the way we will get paid, we know insurance wasn't going to do this when we started. The way we needed to get paid is we need to convince individuals to give us their money. So to do that, we need to be better than what they could get elsewhere, right? They can't just want the product. They want a doctor who is available. So we built a whole experience which has a highly available doctor that you can text, you can email, you can video call, whatever you want to do. So what we actually see is these patients, they start their treatment and they'll say, I think this is causing me some effects. Can we slow down? And we'll say, okay, we'll slow you down. They'll say, oh, I want to adopt a dog within 2 weeks. Can you speed me up? Okay, we'll speed you up. And so that's a trade-off, and that's a decision on how fast it goes. The protocol you were saying, that's a trade-off between the doctor and the patient, and that's a discussion they have. What we generally see is patients report feeling better within a few weeks, and within a few months, they don't have any allergy symptoms. And this is just what's reported by the patients. Then to keep you locked in, to make sure this immune change lasts for your whole life, the suggested treatment time is 3 years.
And then you're off the medication.
And you're off the medication. You're fixed. You don't have to worry about it. If you move countries, you might have different pollens in your area. And so that might come back. But we treat you for what's affecting you, right? We can't treat you for the whole world.
And just to get a bit into the numbers, how many people have you treated by now?
Oh, we've treated thousands of people, right? And then even more interestingly is the way we got started was by having my co-founder, who is a doctor, having him just sit down and give and answer questions on video as if someone was sitting in front of him getting their allergy, the questions you would ask any allergy doctor. And those videos they get millions of views every month. We've touched many, many lives.
What is the success rate?
The treatment's incredibly successful.
Yeah.
If you stay on it, clinical research, not just our patient population, but like published research in medical journals shows that it can be up to 90%.
Okay. And for the 10%, what is the reason for this?
Yeah. So if it doesn't work, what we generally see is it's a few things, right? The first off is you could have non-allergic rhinitis. So that's when you have the symptoms of allergies, but it's not caused by allergies, right? So the diagnosis was incorrect.
Yeah, right.
The other one would be if you had a hidden condition which made the treatment modality no longer effective or acceptable, right? So since this is a autoimmune disorder and we're adjusting your immune system, If you have any hidden autoimmune disorders that you didn't know about, they are going to show up. Um, and then finally, some people just don't like the taste of the drops. So
Okay.
we've started sweetening them, so because they also adds like a slight antibacterial property. So that's that complaint has certainly reduced.
Sounds like, I mean, this sounds like something a scientist would never think about the taste of the of the pill. But this actually prevents some people to take it, probably, which is
Well,
probably
the way
not
I
that
think
smart.
about it is my job. If I want to heal the most people, I
Yeah,
need to make sure that they stay on the treatment,
yeah, sure.
right? It's not effective for them just to start. They actually need to finish. So, yeah, if someone is saying, yeah, especially when you have children, and we have a
Yeah,
bunch of kids
yeah.
that are doing this, it's already hard to get kids to do anything, man. So you have to you have to make it easier for them.
If this concept works so well, have you been the first to bring it to the masses?
To the masses. It's available in the United States if
Yeah,
you go places which aren't necessarily completely revenue driven. So if you go to large academic centers like Stanford, Harvard, Johns Hopkins, those hospitals, they would prescribe something like this. There's even there's FDA approved tablets which are used. So a large pharmaceutical company tried to get this into more people's hands. I think what's difficult is in healthcare, everyone goes to their doctor. People trust their doctor. Even though you can go looking for it online and this and that, people still go to their doctor. So the doctors do what they are comfortable with and what they know and what they understand. So one of the big advantages that we developed for ourselves was we made sure that my co-founder, Dr. Manan Shah, is someone who is very well respected, is someone who holds positions of authority within the medical field. And so that way it does increase how many people are comfortable with prescribing what we do. So I would say there had been attempts to make this happen in the past, but no one had actually driven the education required and the access required, right? Because especially in the past few years, we've seen telehealth become much more common. And so when one treatment requires going into the office every week for 5 years and the other treatment you can do at home, more patients are also choosing the treatment you can do at home.
I was thinking when I mean, I looked up your website and and your references and also the clinical studies, and everything looks so professional and really trustful. And I think this is a super important aspect, right? Because you're giving up control as a patient when you go to a doctor, and if you go there in person, you have a certain level of trust. Probably this was one of the greatest challenges, right? To build up trust.
Absolutely. Absolutely. I think, no one is more vulnerable and scared than
Yeah.
when they are sick. I personally, when I'm sick and I don't know what's happening, it does create moments of fear. So we want to create a brand and create a space where if patients came to us, they would feel like this is the doctor I want to work with. These are the people I want to work with because they are professional, because they are legitimate. We didn't want a appearance that was like an Instagram style
Mhm.
direct consumer cutesy brand, right? Where we needed to be professional. That took a long time, but I think it's important to know that because that's what the customer is looking for, because that's what the patients and market is looking for, it allowed us to be successful with that. If the market instead valued I don't know, teenage style hip hop idols from their
Yeah.
doctors, then and that is what we would have to do. You kind of when you run a startup, you kind of have to a lot of your decisions are like, what does the customer want? Which can be very different from what we believe the customer wants when you first start.
So it's not just having a good product, it's also having a good story and concept, I would say.
Thank you. I appreciate it. You're absolutely right. If it wouldn't have worked, then if it's not what the patients want, if it's not
Yeah.
what the customers want, that's like the number one factor in if a business works or not. I don't know if anyone's on YouTube or Facebook
Mhm.
or like TikTok or whatever. We talk about the algorithm, right? And people act like the Facebook algorithm or the YouTube algorithm is biasing or saying like you want to make something for the algorithm sometimes is what people will say. I think uh there's this idea that an idea that I've seen help founders is, well, your customers are also an algorithm. You kind of need to give them stuff that they want, and then they'll reward you in time, attention, revenue, and then you just kind of have to keep iterating to match that algorithm.
Yeah.
On the flip side, you could just think of YouTube's algorithm or TikTok or Facebook's algorithm as they're just proxies for what people want, for that demand. So
Yeah.
sometimes you'll see it shape, it definitely shapes what we do. It shapes the language we use, because as we understand our audience more, as we understand our customer base more, we want to give them more of what they want.
So when you started this company, Wyndly, how did the company look like back then?
I think one of the funniest things we learned is when we started it, we thought that people would want to see their doctor all the time. So we would try and set someone up on a doctor's call every month. So every month we would say, you need to see your doctor. You need to see your doctor. And no one wanted to do that. We would have people who were paying us $1,200 a year say, I don't want to see the doctor. I trust everything you do. Just send me the medicine and let me know what questions you have. I was like, what? You don't want to see it? Like, I'm offering you something for free.
Yeah.
It's already included. No, we don't need it. And I realized that I always want to spend the most time with a doctor when I go and see a doctor, because it's so difficult to get in a doctor's office here in the US. And when something is difficult, you want to maximize the time that you have with them. But here, what was happening is our patients realized that we were very available. We were there. We weren't going to play any games or become difficult to access. So instead, they didn't treat the time with us as precious. And they were comfortable knowing, well, if I need to see you, I can get it. And so that was a really big change for us, to say, hey, you need to see a doctor every month, to, hey, you can see a doctor when you want to. And we've basically found out that patients never want to see a doctor. They want to talk to a doctor over text message. They want to talk to a doctor at the very beginning to build that relationship and know that there is someone there, and know that is a real human who has a medical degree reviewing them, talking about them. But afterwards, they're comfortable kind of just email and text message and that type of stuff.
Tells you how much the first impression counts, right?
Yeah.
Then they trust you along the way.
Yeah, it was a huge change for us, and it also had ginormous effects on our projections, because we were projecting 12 doctors visits per person per year, and instead it's like less than one. Saves us a lot of money.
Yeah. How does it work in general to found a startup in the US?
I say what you should do is you should just start trying to sell something. And if you're able to make $100, see if you can make $1,000, see if you can make $10,000. And at $10,000, you probably need to start figuring out if you want to make it professional, right? Is this something you quit your job to do? Is this something you start a business to do? That type of stuff. If you actually want to just start the business, like have a business corporation or entity, there are services online that will let you do it for a few $100s. They're all basically the same. Yeah, then you're good to go. But I think the most important thing is not the paperwork. It's like actually finding your customers and actually making that sale. So another way to look at it is, my little cousin wants to become a YouTuber. And I'm like, well, have you published a video? No, I'm reading, I'm studying, I'm like watching Mr. Beast. I was like, I think you should make a video if you want to become a YouTuber. I don't think watching Mr. Beast is going to make you a YouTuber. So I think it's just about taking that first step, publishing, launching, trying to get that first sale, trying to get that first view, whatever it might be. And you just learn so much by doing that you will eventually find it. That's my belief.
When you overcome this first step, so I think the greatest barrier is yourself, and to make this first step and put you and your idea and your product out there. When you did this, when you achieved this, how is the support of the US?
Yeah, let's say you're ready to move from, I've started my business, I have some revenue. How do I get some fundraising? Y Combinator is a startup accelerator that is based in the US. They have fundamentally changed the culture here in the US. Because what Y Combinator will do is they ask you to apply. It's like a 30-minute application. If you get past the application stage, it's a 10-minute interview, and then they will offer you $500,000 off of just that time. It's a lot of money for a very small time investment. Now, it's very difficult to get into. I think it's less than 1% acceptance rate, but they have made that capital very available. And because Y Combinator is doing that, that means other people are doing similar things. So other people have similar programs. There is just a much larger willingness to say, I'm going to put 10, 20, $100,000 into this company, which like hardly exists, right? Mm-hmm. So your job as the startup founder in those situations is to find the path and tell the story of the path that takes you from your $1,000 in revenue to $100 million in revenue, or even $1 billion, right? It has to be huge. It has to be massive, because when someone just gives you $10,000, they're not doing it. They're taking a huge risk. That's probably going to zero. So that 10,000 needs to turn into 10 million for it to be interesting to them. But I think, look, if you're able to talk to the right people, if you're able to network and connect with the right people, which is very easy to do nowadays with LinkedIn and Twitter, you can certainly get the opportunities to pitch. And I think there's a much higher willingness to kind of just invest, at least in the Bay Area and New York City and LA, than the rest of the US and the rest of the world.
This changed mindset of the fundraisers, this willingness, this increased willingness to give money, does this make it harder or easier for startups to succeed? Because I think it's easier to get money, it's easier to connect, to pitch, to network. But is it also making like competition harder?
I mean, competition is good. That means only the best will survive, right? It's like you want to create as many opportunities as possible. And if the opportunities cannibalize each other, that's okay. Because like, let's use AI, for example. Everyone's got like some AI writer or some AI lawyer. Like there's dozens and dozens. There's no new idea when it comes to AI, but it's okay if there are 5, 10, 20 companies that are doing, I don't know, AI video editing, for example, because eventually one of them will be successful, or none of them will be successful. And the world will know that like, okay, AI video editing is not ready, or now is not the time. My perspective is like, previously, maybe this innovation might have happened within some small groups within the larger established companies. The like entire US is probably spending like, I don't know, $100 million on all these random AI startups in this little example that I'm speaking of. And it's okay. Like it's natural for them to die. Okay. It's more important to die faster than it is it's obviously important to succeed. But if you're not going to succeed, you want to die as quickly as possible. Because as a founder, like it's just not healthy for you to kind of be in a negative situation for forever.
This failing fast to save energy and spend the energy in a more effective way afterwards, after you die.
Exactly.
I think this is one of the fundamental differences between a startup culture in the US and a startup culture in Europe, or at least in Germany. Because I also see it in your CV, that you're a founder of multiple companies. And this thing, a couple of weeks ago, I spoke to a person who is directing a venture lab ecosystem at a university here in Germany. And she was saying, if you found a startup and it fails, it doesn't matter. Then you found another one, and you found another one and another one. But she was the only one who had incorporated this mindset. If you talk to founders in the early stages of the startups, they are still hanging so much on their startup, on their product. I mean, it's natural, I would say, but still. And even if you have failed a startup or multiple startups, your skills that you developed over time are so incredibly valuable also for companies that they probably would hire you, even though you failed several startups. Do you think this is a widely spread mindset of founders in the US, that they say, we want this competition, if we fail fast, and then we move on to our next startup?
Yes, but it requires a certain level of financial and personal comfort to know that you're allowed to fail. If you have invested your entire life savings into something and then it fails, I think that's like really, really hard. So while I do think it is the right mindset, I think it's a difficult mindset to adopt both from like it's a cultural shift, right? Because we spend 20 years of our lives in education where failing is bad, and then you spend, you know, 5, 10, 15 years in a corporate career where you do like failing even on the micro scale is really bad, and then you try and do this shift to like actually you want to fail as quickly as possible, as much as possible. You just want to try as many things out and find the thing which has the most legs. I think it is a very large shift, and also it's a difficult shift because like sometimes it's a lot easier to fail 10 startups if you know you can get, you know, 2 million in funding each time,
Yeah.
versus if you're putting up your own personal capital and putting yourself into debt. You don't want your company to fail. You're not no one wants their company to fail. You're not comfortable with it failing because it feels like it feels like the end of the world. To bring it around, I think it is a mindset that many people have in the startup ecosystem. I think it's a difficult mindset, and I'm not surprised if it's one that's very difficult to develop.
Also the ecosystem around, so that capital is easier available, makes you probably taking on a higher risk, and failure becomes less harmful, or less risky, I would say. I think this is something that influences the mindset of the fundraisers, but also the mindset of the founders.
I mean, then there's also the fact that like the US is ginormous, and
Yeah.
what works in San Francisco may not work in Texas.
Super exciting story. When you look back now to Wyndly, what advices would you give, or what is your best advice for a young founder, for your cousin who wants to start a
YouTube channel.
YouTube
Yeah, I know.
career?
Yeah, I think, you know, if I was to go back in time and give myself advice, it would be move faster, just like, you know, commit to things sooner, get it done faster, just generally like execute faster. And then, you know, don't worry about what everyone else is doing.
Mhm.
Because if this company doesn't work out, it's not because of external factors. It's going to be because of something you yourself could have controlled. And that's basically what it is.
Yeah, that's a great advice. Making fast decisions is the way forward to progress, or to fast failure, and both is a
Yeah, I
win.
mean, I think what it comes down to is feedback loops,
Yeah.
right? So let's say we, as a company, we exist and we do one new thing every week. We try out a new thing every week. That's 52 new things. If we try out 2 new things every week, we've doubled
Yeah.
our, you know, ability to learn, right? If you assume that like trying something new is how you learn. Um, on the flip side, imagine if we only try out one new thing every month, right? That's so slow that you only get 12 shots on goal. And the thing with a startup is once you have some money, is you actually have a timer, right? You have your runway until you run out of money. And so if you're going to run out of money, how does that wrap up? Well, it's very common to only fundraise 2 years worth of runway, right? So that means like you get 2 years worth of costs covered. Are you going to, if you're doing one experiment per month, that's 24 experiments. You don't want to do that. If you do 2 per month, that's 48 experiments. You really just like by moving faster, it actually compounds your learning because you just get through much more. And
Yeah.
then you also feel good, if that makes sense.
Yeah.
Right. Like when you just do more, you're able to go to sleep saying, hey, I did something today. I don't know if it's the right decision, but because I make so many decisions, it doesn't matter if it's right.
I think this is the point. Yeah, making decisions makes you happy because you
Yeah,
decided, and
exactly.
then it's out
It's
of
like
your.
getting stuff done definitely
Yeah.
makes people happy. It makes me happy for sure.
So what is the future plan for Wyndly?
We're focused on growing. We're focused on becoming the, you know, largest allergy practice in the US. If there's opportunities in Europe, you know, I think that'd be really exciting. I think like 25% of our web traffic actually comes from the UK. So maybe there's an opportunity between UK and Ireland. I think, you know, it's global domination as far as allergies are concerned. Just
Mhm.
this is a condition which should not exist. So I'm going to eliminate it.
Oh, the best for this journey was a super interesting discussion about healthcare
Thanks for
system,
having me on, Luke.
startup culture, Anything you want to add?
Yeah, if anyone's in the US and has allergy issues, I'm happy to talk to you. You can email me at aakash@wyndly.com. You can find us on our website. I'll get you set up with one of our doctors and you'll be good to go.
Amazing. Thank you very much. All the best to you and to Wyndly.
Thanks so much, Lucas.